We're managing well so far. Really impressed by the commitment, dedication of our people. We obviously have a lot of experience leading through previous pandemics, epidemics, wildfires and floods in California, but certainly nothing on this scale before.
Do you have the protective gear you need, the equipment you need to address whatever kind of surge you might encounter?
Well, right now it's a bit of a yes and. We have what we need for today and for the immediate future. But as we're doing our surge planning scenarios, that's the work that we are aggressively undertaking. We have several scenarios, kind of a low, medium, and high, that will help us assess everything from our personnel, our beds, our ICU beds, protective equipment, ventilators, to help us understand what the gaps are and how we make sure we can close those gaps. We're aggressively working on supply chain issues, and I've been really gratified to see that we've had outreach from other industries who provide similar kinds of protective equipment, even in the building industry, who has face masks and shields to help us with that issue. Individuals have been very generous, actually, in even donating similar supplies for us. So we're aggressively pursuing all the avenues we can to make sure we keep our people safe, provide the highest quality care. That's our fundamental mission. But how we use that supply obviously matters, and those recommendations are evolving rapidly as well.
So you're getting help from the construction industry, people who do drywall or refinish floors. They're sending over masks that you can use. How about help from government auspices? Is it at a level that seems acceptable to you? Are you getting the assistance you need from either the federal, state, or local government?
Well, I think the biggest impact that we've had so far basically has been in the state of California, where we've had the shelter in place put in place. I think that's really important, helping to spread to manage the spread of the virus. For example, we know in our Northern California locations who put shelter in place in sooner, we've already seen a decrease in the number of calls coming in with symptoms referable to cold, flu, and the coronavirus symptoms. In Southern California, those shelter-in-place guidelines went into place up last Thursday, and so we haven't yet seen that decrease, but we expect that to happen for us. So I do think that social distancing, self-quarantining, shelter-in-place is one of the most important things that we can do to help slow the spread of the virus. We've been gratified to hear that the government is opening up some of the stockpiles to some of the equipment. We know in the state of California that the governor has allocated resources to allow us to lease several hospitals in the state that can be open potentially when the surge comes to help meet bed demand. So I'd say, yes, there's a lot of activity going on to help us meet the demands that we anticipate that we'll be facing.